A montage shows kids playing, learning, eating, and exercising at school. Text, WSCC, Whole School, Whole Community, Whole Child. A collaborative approach to learning and health. National Association of Chronic Disease Directors, promoting health, preventing disease. Administrator support and commitment for WSCC approach. The WSCC model, developed by Centers for Disease Control and Prevention and ASCD, shows a child at the center surrounded by a 5-point star labeled healthy, safe, engaged, supported, challenged. Then, a ring around the star reads, coordinating policy, process, and practice, improving learning and improving health. The next ring is divided into segments for health education and physical activity, nutrition, environment, and services, health services, social and emotional climate, counseling, psychological and social services, physical environment, employee wellness, family engagement, and community involvement. The entire model is encompassed within community. Chris Lineberry, Ed D., School Principal, Stanfield Elementary School District, Arizona.
Health and wellness are an integral part of what we do because we see what we do as being key to kids being academically successful. We have to address the needs of the whole child.
A sign reads Stanfield Roadrunners, and students walk past a playground. Jennifer Schrader, Governing Board Member and Parent, Stanfield Elementary School District, Arizona.
We want them to leave their problems at the door so many times so that they can come in and they can learn. But the truth of the matter is they can't leave all of their problems at the door. They bring them to the school. And I think the schools are now responsible for trying to make sure that they deal with those issues.
By looking at what the research says, it's easy to see that in order to get kids where we want them to be, we have to make sure their basic needs are met. And the WISC approach helps us to be able to do that.
A poster reads, Wanted, Cowboy Ethics. Students work on laptops in a classroom, choose food in a cafeteria, and play on a play structure. Text, Providing Leadership and Support. David Cohn, M.Ed., Director of Curriculum, Instruction, and Assessment, Springfield School District, Vermont.
I have learned through my time as curriculum director, it's near impossible for us to separate out school from home from community. And so what I love about this model is that it doesn't separate those things out. It marries all of those. But I think you certainly need at least one consistent administrator who's there and who's not just there to sign off on it, but who really believes in it.
Educators and administrators hold a meeting. Jeffrey Smith, Ed D., Superintendent, Balsz School District, Arizona.
The WISC model helps kids to be more academically prepared, but it also helps them to be happier and healthier within the school. For example, when I talk about breakfast in the classroom, how many more kids come to school on time? How many more kids are here ready for learning? How does that impact their day? That doesn't necessarily correlate into a test score today, but over a long period of time, it helps kids be more successful.
Students choose healthy snacks from coolers. Melissa Sadorf, Ed D., Superintendent, Stanfield Elementary School, Arizona.
As a superintendent, it really is my responsibility to make sure that the system is functioning in a way that supports students, that there are protocols, that there are fiscal allocations, that there's policy in place. And so it really has become a calling of mine to make sure that for my community, health and wellness is at the top of everybody's list.
Big ships turn slowly, and it takes time for that philosophy and that culture to build. We have been able to meet the needs of students on a health and wellness level, emotional level, physical level, nutrition level, and we haven't gone backwards. Our kids get 45 minutes of physical activity every day. It hasn't impacted their academics negatively.
Students walk a balance beam, then do sit-ups. Jenny Anderson, M.Ed., BSN RN, School Nurse, Springfield High School, Vermont.
The administrative support is so important because if there's any physical changes that need to take in the building, or if you're changing a policy or even changing the lunch time that kids can go outside, administration has to be involved. I feel very fortunate that we've had strong administrative support, definitely supporting the decisions made.
Students snowshoe up a hill. Text, engaging school staff and building capacity. Melissa Sadorf.
What is it that we can provide in terms of background knowledge for the teachers or professional development so that they understand the importance of what we're doing? But the why is a big part of ensuring that you have teacher support.
Melissa meets with other administrators and educators. Carrie Van Slyke, counselor, Stanfield Elementary School, Arizona.
I'm very proud of the fact that from top-down administration, they're very supportive of the whole child, and they really want to see each of the children here supported, however that looks. So I really have had the opportunity to look at various resources, go to different trainings, and whatnot.
Josh Mybus, MEd, physical education teacher, Crockett Elementary School, Arizona.
Giving the teachers that freedom to navigate and research and find outlets. And I think that it's a mindset. If a teacher is in this mindset of restriction and I have to follow this mold or this protocol, you're not going to get that creativity. You're not going to get that teacher that's going to take that initiation to go out and find programs.
Text, moving WSCC forward. David Cohn.
We have teachers who are really into health and wellness, whether it's bringing in a farm-to-school program at our middle school or planting fruits and vegetables in a vegetable garden right on school grounds. And so I think you'll find that you have a lot of staff who are already inspired around this work.
Jeffrey Smith meets with students in classrooms and the cafeteria.
Just opening up the world of an educator to see that it's more than just data on a sheet of paper and how much kids are learning, and it's as important to open their eyes to a different way to live that could help them to be healthier throughout their lives.
Students meditate at their desks, and a dentist performs exams in a gym. Chris Lineberry.
What I like about the WSCC model is that it helps me to empower people, see a change in people's lives that happens right in front of me that's bigger than just academics. And we're the ones who have to make the decisions and the choices and take the action that's going to improve the lives of kids. Because they're 100% of our future, and we owe it to them to give them the best of our abilities to help them reach their greatest potential.
Visit chronicdisease.org/schoolhealth for videos and more resources to help you implement the WSCC model. A logo, National Association of Chronic Disease Directors, promoting health, preventing disease. Facebook, Chronic Disease Directors. Twitter, @NACDDinfo.